Diabetes mellitus, a condition characterized by high levels of sugar in the blood, can affect the reproductive function in both men and women. Research have shown that having diabetes mellitus, regardless of the type, it can negatively affect fertility for both men and women, especially if diabetes mellitus is not well controlled and diabetes is not within targets. In men, diabetes mellitus can negatively affect fertility in many different ways. Having a long-standing diabetes mellitus can increase the tendency of having complications such as neuropathy and vessel problems. This can lead to erectile dysfunction in men. Even more, diabetes can negatively affect the sperm quality and the sperm quantity, which negatively affect fertility. Uncontrolled blood sugar can also cause alterations in the DNA, in the sperm DNA, which negatively affect fertility and even leads to a poor quality of embryo, which may increase the risk of having fetal malformations. In women, having type 1 diabetes or type 2 diabetes can also negatively affect fertility because it affects the female hormones production. Having type 2 diabetes specifically may lead to insulin resistance, and having insulin resistance would lead to higher levels of insulin in the body, and the high levels of insulin would increase the male androgen production in women, which negatively affect the female reproductive axis and increase the tendency of having polycystic ovary syndrome, another condition associated with higher chances of infertility. Even more, having uncontrolled sugar is a risk for having pregnancy because it increases the risk of having fetal malformations and also increases the risk of miscarriages. It's very important, whether it's a man or a woman with diabetes, to consult their doctor in advance in order to increase their chances of fertility by having a proper control of their diabetes, improving their lifestyle and doing exercise, and trying to have the sugar within targets before pregnancy is even planned.